Well, I'm going to begin by saying it's not the molecular epidemiology, it's the molecular ecology, yes. And that's fine, because I wanted to point out, if we talk about cross-sector collaboration, I'm the chief of a group of ecologists and biologists that are not really thinking about public health in the sense that we're thinking about public health today. And I have found myself there in a position to really try to promote a different way of thinking. So I am really excited to be here to participate in the roundtable on population health improvement and to share with you a little bit about one area in EPA where we're looking at health impact assessments and linking EPA research to community decisions. And I'll have to figure out how do I make it go to the next one? I apologize. Is it this? No. Does this count on my timing? Can I have 30 seconds back?
This one, right?
Is it this one? All right.
Maybe you have to.
All right, great. Okay, thank you. I'm going to give you a little bit of an introduction to EPA's Office of Research and Development Sustainable and Healthy Communities Research Program, define health impact assessment, talk to you about how we're linking health impact assessment and our sustainable and healthy communities research, and then end very briefly with an overview of a health impact assessment that we're conducting in the Proctor Creek communities of Atlanta, Georgia. All right. Whoops, wrong direction. My apologies. So EPA's Office of Research and Development is the research arm of EPA, and we provide the scientific methods and technology to support EPA's mission of protecting human health and the environment. There are 6 major plans that guide ORD research. There's the Human Health Risk Assessment, Homeland Security, Air, Climate, and Energy, Safe and Sustainable Water Resources, Chemical Safety for Sustainability, and Sustainable and Healthy Communities, which is the one I'm going to talk to you about today. In the Sustainable and Healthy Communities Research Program, we think of a sustainable community as one that protects the health and well-being of all residents, that it has an economically healthy with a return on public investments, provides new opportunities, and it also conserves natural resources and open space. So when communities are considering transportation plans, new development, we find that they often focus on only one of these objectives and not really looking at health, public investment, economic, and the environment all at once. So the SHC program is based on the principle that a systems approach will improve a community's ability to really collectively address all of these objectives. So a vision of ORD's program, the SHC program, is to inform and empower communities to include human health, economic, and environmental factors into their decisions in a way that fosters community sustainability. So basically what we're all about is actionable science for communities. We want to be able to bring the tools to communities and community decision makers to be able to look at all of those pieces. There were some listening sessions that were conducted across the U.S. at the community level, and through those listening sessions, the SHC program decided to focus on 4 sectors because these are the sectors that communities said they wanted help with: transportation, housing, buildings, infrastructure, land use planning, waste management, and site revitalization. So the program is focusing primarily on those 4 sectors and focusing on ways to help communities make great decisions looking across health, economy, and environment. So now I'm going to turn to health impact assessment. And this is the first time you're going to hear about health impact assessment today, but I guarantee you that it will not be the last time that you hear about it. So here's just a quick definition. It's a process that uses scientific data, health expertise, and public input to factor public health and bring it to the forefront in the decision-making process. HIAs can give state and local decision makers information that they need to consider public health in plans, policies, or projects. We did an extensive review of about 80 to 100 health impact assessments that were conducted in the U.S. in the last 10 years, and we found that state and local decision makers are using HIAs in projects and decisions around things such as mass transit and highway and bridge design, housing and energy assistance programs, comprehensive planning and growth policies, as well as energy programs and natural resource management, including fossil fuel exploration and development, renewable energy, and water management policies. So health impact assessment has a number of steps that are traditionally found in a health impact assessment. The first one is a screening step, which is basically asking the question, is the pending policy or plan, would it benefit from a health impact assessment? And could that assessment be conducted in a time frame that could actually influence the decision around the policy or the project? The scoping step identifies what health or potential health impacts could be impacted by the policy and which ones will be considered in the assessment. The assessment step looks at both the risks and the benefits of the policy, identifies which people, which populations may be affected and how they may be affected. And the assessment step provides the foundation for developing recommendations. So these recommendations are suggested changes to the policy, the plan, the proposal that would promote positive health effects and mitigate adverse health effects. And I'd like to also say that health impact assessment goes beyond looking at traditional contaminant-based evaluations and looking at other health determinants as well, such as walkability, bikeability, access to healthy food. The next step of a HIA is the reporting step, which is incredibly important. The report documents all of the previous steps, is very transparent, and provides the recommendations and results to the decision makers. And then the last step of the process is the evaluation step, which actually occurs after the report is provided and determines the effect of the HIA on the decision process. So, what does HIA have to do with ORD? Well, the goals of an HIA track very well with the goals of what we're trying to achieve in the Sustainable and Healthy Communities Research Program. And the number of HIAs in the U.S. is growing exponentially. We've seen a large uptake in communities using HIA in the last 10 years. And so that growing community of practice can inform our research by telling us what are the decisions that communities are facing and how are they bringing health, economic, and environmental information to the process. And it can also provide a network to disseminate our research, our tools, our models, our guidance, and give us a forum to raise awareness of sustainable alternatives. Right now, what we're doing is we are providing some web-based tools, models, and approaches to support health impact assessment. And we're also undertaking some HIAs ourselves as EPA and demonstrating it as an approach to integrate and weigh trade-offs in community decision-making. So I want to talk just briefly about one HIA that we're involved in Atlanta, Georgia. It's called the Proctor Creek Boone Boulevard Green Street Project. The decision is implementation of a green infrastructure project along Boone Boulevard in concert with a road diet. The decision makers are the City of Atlanta And the role of the HIA is to evaluate the potential positive and negative public health impacts of the Green Street project design and provide that information to the stakeholder as part of their decision framework. The lead is EPA, the Region 4 Office of Environmental Justice, and the Office of Research and Development. We have a number of partners, including the Fulton County Health Department and the CDC. I just wanted to give you a really quick description of green infrastructure. What is it? Well, it is not concrete and it is not pipes. It's a way to use natural processes to maintain healthy waters, protect the environment, control stormwater and flooding, and also support sustainability. And the planter boxes at the top and the urban tree canopy are two of the green infrastructure approaches suggested for the Boone Boulevard project. Here's the location of the Green Street, and I just wanted you to see it's just below the Georgia Dome. The two communities that are impacted are the English Avenue community and the Vine City community. And this is an area with a lot of impervious surface and a number of issues with flooding. These communities are predominantly low-income, minority populations that are suffering from a number of environmental problems, pervasive flooding, impaired water quality, poverty, a number of boarded-up properties, and aging infrastructure. We have developed some very strong partnerships around this particular health impact assessment. We've leveraged the HUD-DOT EPA partnership for sustainable and healthy communities. As you can see from this list, we have 8 federal agencies participating all the way down to 10 community organizations in the project with participation from multiple sectors, including public health, transportation, education, and the Forest Service. So why are we interested in this project from an ORD, Sustainable and Healthy Communities lens? We see that this can provide a model of interagency collaboration at the local, state, and federal levels. We can gain experience in the application of this type of HIA and other environmental decision-making processes. And I also think one of the really important things is we can create this better understanding of the direct and the indirect public health benefits from implementing green infrastructure. So green infrastructure can bring a whole rainbow of health benefits to a community. It's not just about controlling water. It's about creating green space. It's about creating space for social cohesion and also possibly for mitigating effects from prolonged heat events. So that is it. Thank you very much.
Thank you so much. I'll stay here to minimize the walking back and forth. Next, I'd like to welcome Beth Osborne, Deputy Assistant Secretary for Transportation Policy in the U.S. Department of Transportation.